Good afternoon once again, and we sincerely apologize for bringing the show late. This is due to some technical difficulties that we faced, and fortunate enough, we are able to get to go live now. So, good afternoon, Natasha, and welcome to the Health Live show.
Good afternoon, Lighton. Thank you for having me.
Oh, great. So, how's the weather there in Lusaka?
Well, it's quite hot actually. It's quite hot, but we are getting through it. We're really getting through it.
Yeah, okay, great. Anyways, so this is the Health Live show, a show that brings to you different issues affecting young people. Specifically, we are dealing with health issues around your community and around you. So, on today's show, we'll be looking at access to HIV/SRH services for adolescents and young people. And also, we'll be looking at how parental consent is, or rather, if at all, parental consent is a barrier to adolescents' access to HIV/slash sexual reproductive health services. So, Natasha, getting into it, before we get into the main agenda of today's show, I'm fortunate enough to announce to you that very soon we'll be going for the Regional Adolescents Health Indaba on the 8th and 9th of April 2022. So, how excited are you as a young person? Hello, Tasha, can you get me?
You were breaking, so if you could repeat your question again.
Can you get me now?
Yes, now I can get you.
Okay, so I was saying that very soon we'll be going for the Regional Adolescents Health Indaba to be hosted by Zambian Youth Platform. So, how excited are you?
Thank you, Lighton. I am very excited. First of all, as a young person, I believe the Regional Adolescent Indaba is a place for young people to actually express themselves, share their voices, and share what exactly their needs are, and actually find solutions to these needs. So it's really just a great platform for networking as well. And it's for young people and by the young people themselves. So I'm really excited that young people will get to come together and actually share their voices and their best practices as well.
All right, great. Anyway, I can't wait to see you and also to see a lot of young people out there who are so anxious and eager to get to the Rahai or the Indaba. So, getting into the main agenda for today, I just want to find out for you, what are some of the priority needs that you think young people are interested into? What are some of the priority needs for adolescents and young people in terms of health? Are there anything specific that you feel young people need in terms of health?
Okay, so one thing I would like to mention actually with regards to that question is something that has actually come up recently. We're seeing the high cases of suicides happening amongst our young people. So I think one of the priority health needs right now is mental health. I think mental health should be something that should be prioritized, as well as HIV testing and counseling, and other sexual and reproductive health and rights services. These are health needs that young people actually need. These are things that should be priority for young people. If we are to develop our country and have healthy young people who actually take our country forward, it is important that these needs are actually prioritized: the mental health of young people and the sexual and reproductive health of young people as well.
Talking of sexual reproductive health of young people, there's somebody out there who is an adolescent or a young person who is being denied access to HIV testing and access to sexual reproductive health services due to the fact that they have to seek a parental consent, or maybe they have to get a signed consent from their parents to take to the clinic or hospital to test for HIV and other services. What's your comment on that?
Okay. My comment would be that I hope I won't be getting ahead of myself. I think there needs to be a review of the policy. I think all this comes about on the age of consent to access to HIV testing. The Penal Code actually describes a child as someone who is under the age of 16. So presumably, it's just presumed that someone who's below the age of 16 cannot be sexually active. But then you find that actually we are having young people having an early sexual debut, having young people at the age of 14 being sexually active. And then if the age of consent is at 16 and you have a young person who is younger than 16 who needs a service, so this becomes a barrier to them actually getting this service. So I believe that the age of consent or the parental consent aspect should be revised, because not every young person wants to tell their parents why they want to get an HIV test, why they want to get contraceptives. These are sort of uncomfortable conversations that most young people have with their parents. So I think it's something that should be reviewed and revised if we are to promote the health of young people.
Okay, well, I can see interesting comments coming out from our viewers. So some are following in from, we've seen Vashon, who is following from Solwezi. So thank you so much for all, and also for being part of the show. I can see Miranda following from Livingstone, and also other people who are following. So thank you so much once again. And continuing, Natasha, you mentioned the aspect of policy and the fact that the penal code defines a child to be somebody above the age of 16. Apparently, we've seen cases of teenage pregnancies, and we've seen adolescents as young as 11, 12, 13, 14 being pregnant and whatnot. So why do you think there is a need to ensure that the policies should be reviewed? And also, do you think if at all the policies are reviewed, we can see actually a gradual decrease or maybe a prevention of vices like teenage pregnancies, and also a prevention of HIV escalation and whatnot?
Okay, I didn't really get you clearly, but I think I got some parts from what you said. I believe that HIV testing and counseling is a pathway for care and treatment for us to get to a point where we can actually care and treat our young people. So I believe that if the age of consent policy is reviewed, young people can actually have access to some of these sexual and reproductive health services. They can have access to modern contraceptives. They can have access to HIV testing and counseling. So the review of this policy is actually a very important aspect, looking at the fact that we have so many young people who are indulging in sexual activities. There's an early sexual debut amongst our young people, and it's something that we can't run away from. And of course, it's something that should, in a certain essence, worry us, but that's where the part of information comes in. We get to inform our young people. Let's equip them with the accurate information that will empower them to make informed decisions with regards to their health and well-being.
All right. Well, there's a parent out there who thinks, or rather, who is saying at the moment that the moment you get to lower the age of consent, it simply means you're encouraging adolescents and young people to be having sex because they know that they can access these services easily. So, what's your comment on such guardians or maybe such parents who do not want to see adolescents accessing services such as HIV testing and also maybe even condoms and whatnot because of the age limit, or maybe the fact that they're still young and it's not important for them to access such services?
Okay, that's a very, very interesting question, Lighton. Firstly, I would like to say that I've come to discover that actually parents are not so difficult people. And I think there's a tendency to think parents are always against certain things. But I think the important thing is sitting down with parents and informing them of the current situation, the current prevalence rate of HIV amongst young people. A third quarter of HIV cases annually are from young people between the ages of 10 and 19. So this is evidence that actually parents can review and see for themselves that some of these services are actually very important. So I think information being given to our parents and shared to our parents is actually a key to getting them to open up to such things, open up to ensuring that young people have these services. And I think it's also important on the parental side when it comes to support and care. If your parent is in support of certain things. I think that's where even the issues of mental health are coming from. We talk about support. Support is essential, even from parents. So I believe information is one key route we can actually use to get to our parents as well.
All right, Natasha. Moving on. So, maybe there's somebody out there who doesn't really understand what parental consent is, what age of consent is. Maybe briefly, you can just get to highlight what parental consent as well as age of consent are in relation to HIV testing or other HIV services as well as sexual reproductive health.
Okay. Firstly, I would like to say that the Penal Code section 2 and 13, I hope I am correct when it comes to the laws. I'm not a lawyer, but I hope I am correct on those. It actually defines a child as any person under the age of 16. So any person under the age of 16 is described as a child. And then we have an issue of the age of consent for sexual intercourse is 16 and above. So I think that's where all these things come from, where when you want to access, because it's an assumption that the age of consent for sexual intercourse is at 16, and then you come and you want to access modern contraceptives and you are below the age of 16. So in practice, there's actually no legal requirement for parental consent, but in practice, because of the age of consent for intercourse, it becomes something that is made that you actually need parental consent. So parental consent is pretty much the right of a parent to be informed or to actually be involved before a child makes a decision towards something or takes up an activity. So for example, HIV testing. So the age of consent for HIV testing and counseling is 16 years and above. So if you're younger than 16, for you to actually take an HIV test, to undergo HIV testing and counseling, you need parental consent. Parents, one or two of the parents need to be involved, and even the results need to be shared with your parents as well.
Well, you put it very well, Natasha. But interestingly, I've just thought of something. So, growing up, you had situations where maybe at your school, they've brought services like HIV testing and whatnot, and you are an adolescent, you are below 16 and whatnot. Then you really want to test, you rush home, but the moment you reach home, you fail to talk to your parents to say, "Mom or Dad, I'm kind of asking for a consent for me to test for HIV." So how easy is it, do you think, how easy rather is it for adolescents to seek for parental consent from parents, considering all this talk about them being young, them not being HIV testing not being necessary for them and whatnot? How easy or how hard is it for adolescents to seek for parental consent to test for HIV and also to access other services?
Thank you, Lighton. As you have put it, the situation is not actually as easy as it sounds, because, like I mentioned earlier, it's it's not something that young people are comfortable with having conversations with their parents about, and there's so many dynamics around it, because it may not only comes to issues of sexual activity, but also substance abuse. So the moment you go to your parents and you say, okay, I need consent to take an HIV test, the first question really your parents is, okay, what have you been doing? What have you been up to? Because of course, the most common way of contracting HIV that most people know is through sexual intercourse. And so it really just gets that. But like I mentioned, that really information is key to getting parents involved. And like I said, I've interacted with a number of parents myself, and I have noted that they're not really difficult people. Let's not place so much, let's
Maybe,
not be too hard
maybe,
on these
maybe
people. As long as they have the
it's
information, they have the evidence, they're seeing it, they're actually great people.
Sorry to cut you short. Maybe it is because of the fact that you are maybe at an age where you can freely make your own decisions, as well as maybe even test for
Mhm.
HIV or access services without their consent. But practically speaking, Natasha, I think
Yes.
our setup as Africans and also specifically as Zambians, they're just those specific issues that parents have with regards to young people. For example, if I was to walk up to my parents I'm 11 or I'm 12 or I'm 13, and then I just tell the mom I want to test for HIV. The first question would be, are you having sex? Or why would you want to test for
Yes.
HIV? Such things. So what is your comment? Because like you've mentioned, it's uncomfortable, not because young people are not capable of speaking to parents, but because of the environment that our parents have created, where they undermine, or rather where they have a perception that young people are not actually sexually active. So what should be done to ensure that there is that cordial conversations or relationships between young people, adolescents specifically, and parents, and also to ensure that it's easier for young people to access HIV services as well as SRH services?
Okay, thank you so much. And I'm not sure, I think one of the organizations I work with has actually been doing an intervention with regards to parents by having meetings with parents. Like, you have parents in a meeting and you have young people as well, getting the parents involved and informed of some of the health issues of the young people and how they need their support as well. So I think that's one of the interventions that we can actually take up by having dialogue meetings with parents to get them to understand. And if one parent is informed, they inform another parent. It's like a cascading effect that goes on and on. So it's important that we actually have a sit down. Let's not completely throw away the initiative of having sit downs with our parents as well.
All right. In case you've just joined us, this is the Health Live Show, brought to you by Zambian Youth Platform, a platform where we get to discuss issues affecting young people in your communities and also in our communities. And right about now, we are looking at access to HIV and sexual reproductive health services by adolescents and young people. Vis-a-vis, we are also looking at parental consent and also its effect on the access to HIV and SRH services by adolescents and young people. So maybe just reading some of the comments coming through, Natasha. So we've seen a comment coming from Stefan Chikwa Jr., who says, how far has the ministry gone with revising the adolescent health strategy, which I suppose came to an end in 2021? However, we had a meeting in January where the ministry said they have made some strides on the age of consent. I think Natasha was also part of the meeting. Anything that ZYP can share on that? Natasha, somebody just informed us that you're part of the...
Was I?
Any comment on that?
Was I? Well, I am aware that there was a review and progress was being made, but unfortunately, I wasn't part of that meeting, so I do
Maybe
not want to.
somebody through you.
I do not want to speak and be misquoted that I was in the meeting, and I don't want to be misquoted. So unfortunately, I wasn't in that meeting, but I could get information, and yeah.
Well, I think somebody needed a comment from us.
Yes, ZYP.
Yeah, as ZYP, I think, yeah, like you've highlighted, so strides are being made with regards to issues. Like, how it's a process to come up with these policies and whatnot. And as an organization, also, we've been in the forefront to ensure that we advocate for review of certain policies, for example, age of consent and whatnot. So our humble appeal, or maybe our expectations, is that the lawmakers should also ensure that they take what young people want and also review some of these policies. Anyway, so should be able to get more insight on that, and maybe we can discuss more in our coming show. But for now, we continue, and moving on, Natasha. Apart from the issues of parental consent and the age of consent and whatnot, what are some of the barriers that are leading to adolescents and young people not to access um, HIV services as well as sexual reproductive health services? We've seen some saying or alleging that the attitude of health workers is making them to shun away from services. What do you think are some of the barriers apart from what young people are highlighting, like the attitudes and whatnot?
Okay, I am of the firm belief that availability of something actually ensures that one adheres to it and uptakes something. So I think there's been an issue of availability of commodities, sexual and reproductive health commodities. It's one thing for something to be accessible. For example, I can say I can access a hospital, I can go to a youth-friendly space. But the question is the commodity that I'm looking for available? Especially during the period of the COVID-19, we had several stockouts of some of these commodities, sexual reproductive health commodities, modern contraceptives were not really available in most of these health facilities. So I think availability of sexual and reproductive health commodities has really been a barrier for young people. For example, what another person uses may not be what I use, and if it's not there, so it's a barrier for me to actually access a sexual and reproductive health right service. And also commenting on the perceived attitude of healthcare providers. I would like to mention that it's important to actually give credit where it's due. I've noticed that healthcare workers, we now have adolescent focal point persons in our youth-friendly spaces, and we have healthcare workers who are actually being trained to actually cater for the needs of adolescents and young people. So even their attitudes are beginning to change gradually. We may not be there yet, but I believe that there's progress that has been made actually.
All right, Natasha, maybe the technical guys can help us with the comments before we conclude the show, such maybe we read some of the comments and maybe you can get to talk about, or maybe comment on what these guys are asking. So we've seen another comment saying, coming from Stefan Chikwa Jr., who's saying, thank you, Natasha, for your comment on mental health. We need a holistic approach to adolescent health. The friendly spaces should integrate mental health with professionals, particularly in the area of mental health. A counselor in the area of HIV is not good enough to handle youths facing mental health challenges. Interestingly, in other countries, SRH services have been integrated with mental health services because there are some issues that could be traumatizing. It's high time we adopt that. Thank you so much, Chikwa, and it is good to know that you are also watching. Sorry to put you on the spotlight, Natasha. The meeting I mentioned was not hosted by MOH, but the Youth Power Hub in Zambia, where we had the MOH and Ministry of Education. So it seems like Stefan is on you, huh? The fact that he saw you meeting. Anyway, thank you so much for the comments coming through. And maybe just in winding up, Natasha, we can maybe try to highlight some of the issues that young people are going through out there, because we know that there are quite a number. Apart from the issues that we've raised here, we've seen issues of long distances, especially in rural setups where we get to have adolescents and young people walk all the way from their homes, maybe kilometers away, until they get to access services at a health facility. What should be done, or what can be done to ensure that we ease some of these challenges for adolescents and young people specifically?
Okay, thank you so much, Lighton. And I believe that the promotion of the health and well-being of young people is not just generally the job of the Ministry of Health or government alone, but this is something that should have concerted efforts. We should actually have an integrated effort, a multi-sector effort, a complementary effort from civil society as well. Me being part of an organization, we do outreach. We actually work with healthcare providers from these youth-friendly spaces. So I believe that civil society organizations can actually come up and do outreaches to actually reach the young people where they are. And this in itself, this platform right now is actually a great platform to reach young people. We are informing young people right in the comfort of their homes. They are getting informed about their sexual and reproductive health rights. They're getting informed about the age of consent. So already this is something that is being done, working towards young people being able to access information and education as well as counseling services. So this should be an effort not just for the government, not only for Ministry of Health, but for everyone, even each and every one of us as an individual. Personally, for me, I also involve my church because I know young people are always going to come to church. So I use that opportunity to talk about HIV. I use that opportunity to talk about sexual and reproductive health, seeing the fact that even in the church we're having some of these issues. So
We
I
really
believe
talk
that each
about
and every
that,
one of
which
us
is
can
interesting.
actually help to spread the word and promote the health and well-being of young people? I
Oh,
do, I
I've just
do, I
seen.
do actually.
Interesting. So I've seen some of the comments also coming from Nino Brown, who says adolescents with verbal challenges have to be looked at in youth-friendly spaces, especially those with hearing challenges. Anything done to address such special people? A quick comment on that, Natasha. Oh, before you comment, I've seen something coming from Miranda Zira, and it says adolescents face challenges such as negative attitudes of service providers, long queues at health facilities, distant health facilities, high costs of services involved, and unfriendly physical structures for persons with physical disability, and the perception from able-bodied people that um, PWPDS should be asexual. Yeah, any comment on that, Natasha? On the two comments, issues to do with uh, um,
Um,
special people or people with living with disabilities, and the fact that they are unable to access some of the services due to the attitude also coming from the health workers as well as people who are able-bodied and whatnot. What is your comment?
Thank you, Lighton. I totally agree with Miranda and Nino, if I'm not mistaken. They are very right. When we talk about leaving no one behind, that means we need to be inclusive. Even in our service provision, we really need to be inclusive. So I really love that they have brought up the fact that even in our youth-friendly spaces, as well as our hospitals, we need services, we need healthcare providers that can actually cater for people with physical challenges, hearing impairments. I think that's a very, very important thing to highlight as well. And even just the structures of our health facilities, they really need to be made in such a way that they're accessible to young people with different disabilities as well. So that's really a great point that has been highlighted by Miranda and Nino.
Under 30, actually 20 seconds, Natasha, there's a comment from Eric saying, with regards to the age of consent for HIV services, are we suggesting that it is scrapped off completely or reduced to an age below 16? Maybe under 20 seconds, you can comment, then wind up.
For my personal opinion, I believe it should actually just be reduced below 16.
It should
I
be
hope that was
reduced.
fast enough.
Yeah, you were. Thank you. Anyways,
Yes.
this has been the Health Live show brought to you by the Zambian Youth Platform. And in case you are just joining us, unfortunately, we are leaving you. And also, remember that this show comes on this platform every now and then, and we get to discuss various issues affecting young people, specifically issues with regards to health. So remember the ABCs of life as an adolescent or as a young person. So abstain. If you can't abstain, be faithful. If you can't be faithful, remember to condomize. So this has been Lighton Nirongo on this platform, and I was joined by Natasha Seketa. Thank you so much, Natasha, for finding time to be on this platform, and we hope you'll be able to pick up your phone once we call for you to feature again.
Thank
Thank
you
you so
so
much.
much for having me. It was an honor and a pleasure. Thank you, Lighton.
Thank you so much. And counting down to the 2021/2022 Regional Adolescents Health Indaba, we hope to see you all, and we hope to have meaningful conversations around health issues affecting young people in your community. So see you then. Until that time, or until the next show, from me and Natasha, it is goodbye and have a great afternoon.